This brief presentation will discuss the differences between evidence-based practice versus anecdote. Hi, I'm Dr. Kim Keebler. I'm the founder and director of the Multiple Chronic Conditions Resource Center, which was highlighted by the U.S. Department of Health and Human Services as a premier resource for all healthcare professionals, patients, and families and policymakers. I'm a clinician of 38 years, a published researcher, an award-winning author, a health policy expert, and educator. I have held multiple federal and state appointments, focusing primarily on chronic conditions, pain, and palliative care, but most importantly, I'm a patient advocate. So what exactly is evidence-based practice? We hear about this a lot, and there's lots of different ideas and thoughts behind this concept. Evidence-based practice implements the best available research or data, also combined with clinical expertise, and to include the patient's unique values and circumstances. Evidence is usually developed and taken from relevant research using sound, unbiased methodology, such as a randomized clinical controlled trial. Clinical expertise is a combination of the clinician's experience, their education, their clinical skills, and the patient is involved in it includes his or her own personal preferences, their concerns, their expectations of care, and their values. Evidence-based practice focuses on the effective approaches to practicing medicine rather than through an anecdote or professional experience alone. The use of evidence involves an ongoing critical review of research or current data, and this is a constant update and refreshment of what is new and current in the literature to promote best practices, and what policies and practices are given to the best available evidence. Examples of evidence-based practice come primarily from randomized clinical trials, meta-analysis or systematic reviews, which are a compilation of randomized controlled trials, and clinical practice guidelines, which include randomized controlled trials, meta-analysis or systematic reviews, and clinical expertise. Clinical practice guidelines are considered the standard of care in managing common conditions and symptoms, for example. Anecdote is a personal story, one person's perspective or report. It's an opinion. It can be a single case study. It's usually not grounded in scientific foundation. It provides unreliable information to impact clinical decision-making and is often considered unsafe since it has not undergone clinical testing and evaluation. Relying on current and relevant data is providing best practices to patients and families and considered safe and effective. Anecdote, on the other hand, is dangerous. It's unsafe, it's untested, and it comes at a high risk for poor clinical outcomes, particularly in debilitated patients who are living with more than 2 chronic conditions at any given time. Staying current requires continuous monitoring of the trends and changes affecting optimal patient-centered outcomes. You can stay current at Multiple Chronic Conditions Resource Center, where you have access to all the most current guidelines in meeting and managing the complex care needs of patients living with 2 or more chronic conditions or multiple chronic conditions.